So, hi everyone, and thank you for being here today. So, today the topic of discussion is the hidden mental battle in cancer, and we have the special guest here with us, Dr. Darshan RS. He is the associate consultant in the Department of Medical Oncology, and he's practicing in Apollo Hospitals in Bangalore. We welcome you, sir.
Uh, what are the common causes of cancer? As it yeah, you can keep the slide. Next slide. All right. As it's depicted in genetics, loads the gun and environment pulls the trigger. So all of us are susceptible in some or the other way to cancer. But the thing is, not everybody develops cancer, and not everybody who has cancer is because of only genetics. There is a lot of intricate factors that are acting together. Patient person is susceptible, but the environment factor and the habits or the addictions, they play another role. Next slide. Okay, so sorry. Just go through that. Okay, the most common habits or addictions that are caused in India, the most common cancers are prevalent in aerodigestive tract, that is mouth and or other oral cavity, then esophagus, then stomach. These are the aerodigestive tract cancers. They are predominantly associated with nicotine substances like tobacco, whether it's a inhaled tobacco or chewable tobacco, and also alcohol. And together, as we all know, together the effect is not only additive, it's multiplicative. It increases in multiples. So any person who is consuming these are at higher risk. Then comes second important factors, that are genetic factors. These factors are predominantly seen in cancers like ovary, breast, and few of the childhood cancers like retinoblastomas, Wilms tumors. And the third most important thing is obesity and our dietary habits. Although there are studies suggesting dietary fiber intake has reduced incidence of gut cancers, but still it is not that supportive. The most important implication is whatever diet we consume, whether it is consumption of lot of red meat, which is associated with colon cancer, and obesity per se, it is associated with ovarian cancers, other gynecological malignancies, and also in breast cancers. Then coming to what are the common symptoms of cancer. Uh, any unexplained weight loss, changes in body, sudden appearance of any lump, which was not there a couple of weeks or a couple of months ago. Then passage of hematuria, there is also change in bowel habits, persistent cough, along with production, blood in sputum, whatever we say. Then bleeding manifestation, abnormal moles, and unexplained weight loss. These are the symptoms of cancer, but it does not mean that all the symptoms has to be there. Along with the patient's risk factors and few couple of symptoms, it gives us a subtle hint towards this might be one of the differentials in a patient with a set of symptoms. So how to prevent cancer? The first thing is avoidance of the risk factors, like avoidance of all kind of tobacco. None of the tobacco products are good for health. None of the tobacco products are considered safe in any cancer. And also there are newer modalities like vaping, which are the data is not yet robust, but still they are associated with many respiratory conditions. Per se, we cannot say they are susceptible for cancer, but still it is better to avoid. Then it is depicted less alcohol is equal to less cancer risk, but still whatever may be the alcohol amount, it is always dangerous to health. There are some studies showing tannins present in wines may be beneficial to health, but still it's better to avoid things which have no proven efficacy elsewhere. Next slide, please. Then the third step, to combat obesity, all we have to do is a regular exercise, keep our physical activity intact. Then to improve our diet, to consumption of green leafy vegetables, improve fibers in our diet, etc. Then next prevention methods are vaccination procedures. There are certain vaccines like hepatitis B vaccines, HPV vaccine. Hepatitis B, it helps in combating hepatocellular carcinoma, which is a liver cancer. Then HPV for cervical cancer, anal cancer, penile cancer, which is predominantly spread by human papilloma virus. Then another important setup is regular checkup by regular clinical examination and self-examination, which helps us to get to the patient at earlier stages. In any case of symptoms, which I said in the previous slide, it's better not to ignore, just it's better to consult a doctor. Next slide, please. Then what are the treatment modalities available? There are multiple modalities like radiotherapy, which uses high fractionated radiation to specifically target cancer cells or tumor. Then surgery, which removes the entire tumor with a capsule intact. Chemotherapy, which targets actively multiplying cells. The next option comes is targeted therapy. There are multiple targetable mutations or targetable biomarkers available in cancer cells, which can be targeted using this. And the next option is hormonal therapy. These are usually can be in adjuvant, that is to prevent recurrences, and also in metastatic settings for specific cancers. Say integration of psychiatric services in cancer diagnosis, treatment, and management. The first is cancer is a complex disease that affects the physical and psychological well-being of either both patient and their families and also the caregivers. So there are multiple studies showing that cancer patients are prone for psychiatric disorders or psychological effects. Like approximately 30% of the patients may experience cancer-related psychological disorders, including anxiety, depression, and post-traumatic stress. And the cause for anxiety is the disease per se. The patient, once they hear cancer, like most of the patients don't have information regarding what is going to happen. Like there is a lot of anxiety about what could be the type of cancer, what could be the treatment options available, what could be the side effect of those treatments, what could be my survival, what could be my quality of life. So these are the lots and lots of questions they come to patient the moment they hear cancer. So then next is depression. Depression is mainly because of the treatment per se. The patient is losing his day-to-day quality of life. Then if he is a breadwinner of the family, he has restricted mobility and also leading to the side effects leading to his reduced day-to-day activities. So eventually the patient feel we feel the burden of the disease in the mode of depression and other. Then post-traumatic stress, it is because of the moment they receive news, it takes time for them to adjust, and also it's a kind of even after getting treatment, and the patient, even if it declare is cured of disease, there is a point that they cannot come back to the normalcy. So this causes the stress in the patients. And next slide, please. Uh, then it is not only the patients who suffer this, they are also caregivers of the patients with experience, significant emotional, physical, and financial stress, which can have a negative impact on their health as well. It is not only the patient health, it is the caregiver's health, because they have to address many issues like the caregiver has to look after the patient as well, and also patients, if the patient is on a pills, he has to make sure that the patient is taking pills properly, and also if the patient is the caregiver is a breadwinner, he has to look after his financial stability, and also he has to go for appointments, he has to take multiple hospital visits, he has to manage support physically also the patient. So it is a burden on the caregiver also. So that's why to address these issues, mental health resources should be integrated into cancer settings to identify and intervene early for individuals with psychological distress. So, what are the prevalence and patterns of cancer-related mental health issues? Like depending on the factors such as type of cancer, stage of the disease, treatment modalities available, and individual characteristics. The some common mental health challenges, which include heightened levels of anxiety, depression, as I said previously, and PTSD, and also adjustment disorders. And younger individuals with advanced disease stages, prior history of mental health conditions, and limited social support networks may be at higher risk. Okay, then I think one more slide was there. It's okay. The initial shock and uncertainty surrounding the diagnosis can lead to a cascade of emotion, as I said, including worry about treatment options, prognosis, impact on one's life. For these factors to be alleviated, social support is a crucial factor in the mental well-being of patients with cancer. The support of family, friends, and healthcare professionals can help patients cope with the emotional and psychological impact of cancer. So that social support can be provided as emotional, informational, and practical support. Emotional support is the most common form of social support which can be provide, which involves providing comfort, empathy, and encouragement to the patient. It helps the patients feel less isolated as well as manage their emotions, reduce stress levels, and therefore family and friends can provide the emotional supports by listening to the patients and their concerns. Then healthcare professionals can provide patients with accurate and reliable information to help them make informed decisions about their care. And this accurate and reliable information, sometimes in our setup, what happens, the patient's relatives, they're little hesitant to involve the patient per se in the treatment decision plans. So our opinion is that even if the patient knows about his status, at least to an extent, it helps them to make a better decision of the treatment choices and help to adjust with the treatment plan and also cope up with the disease stage and effects first. Next slide, please. Another vulnerable subgroup comprises individuals with metastatic and advanced stage cancers. These patients group often experience severe psychological distress due to uncertainty of their outcome and potential side effects of treatment on both physical and mental health. Additionally, the patients with elderly, they constitute another vulnerable group due to their specific physical, cognitive, and psychosocial characteristics. And older individuals may already be facing age-related challenges such as comorbidities, functional limitations, and social isolation. Along, along with the comorbidities, if we add cancer therapy, the therapy burden, bill burden, and it is very difficult for them to adjust to suddenly. If a patient is already on diabetes, hypertension treatment, they are already feeling like, okay, I am already taking so many tablets. Why should I take one more kind of therapy? It becomes hard for us to convince the patient this is also required. Then another vulnerable subgroup consists of pediatric patients with cancer. Usually, children and adolescents facing cancer that they navigate unique challenges, including disrupted education, social isolation, and uncertainties about their future development. And also, if the patient is receiving any radiation to the CNS, it also hampers their intellectual growth. So that is one of other parts we have to consider in these patients. Then many have difficulty in expressing their emotions, leading to increased vulnerability to mental health disorders such as anxiety, depression, and PTSD. Next slide, please. Then, what is the importance of integrated supportive services in cancer? To provide comprehensive care and support to patients and their families, and integrated supportive services are essential in cancer. This is a statement I would like to make. And these services include maybe social counseling, social work, nutrition, and rehabilitation. One of the key benefits of integrated support services is that they can help patients manage the physical symptoms of cancer and its treatment. Then supportive care programs and survivorship services, they play a critical role in addressing mental health. It could provide various interventions like it could include counseling, psychotherapy, medication management for patients with cancer and their families. It helps to manage their mental health issues. Um, then importance of addressing unique needs of caregivers is they affect family as the cancer patient's treatment. It affects the patient, and the change in routine affects the family members. So they have to play a very critical role because they are already having multiple works burdened on them. Then patients with cancer often experience significant emotional, physical, and financial stress, which have negative impact on their own health and well-being. They often handle multiple responsibilities like managing medications, coordinating appointments, providing emotional support to the patients, and their physical health. So, if after saying all these things, we just keep saying, why the patients are not approaching a mental health mental health practitioner or a psychologist or a psychiatrist for the benefit? But we come across multiple barriers for accessing the support services. For the first is stigma and cultural attitude towards mental health and cancer. First, cancer itself is a stigma, mental health itself is a stigma. If you put both together, the patients and the caregivers, both are reluctant to consult a psychiatrist or a psychologist or any mental health practitioner for at least for the basic requirements, they are not be able to cater that easily. Then financial and logistical challenges in accessing supportive services. Yes, cancer therapy, it used to be very expensive, but now with multiple schemes and multiple support programs from the government, it has come to an affordable range. But still, there are logistical challenges in accessing support services. mental, like we have psychologists available. Multiple hospitals have psychologists, specifically onco psychologists, psychiatrists available at their service. But still, patient they travel from a village area to a city kind of for therapy. And if the another consultation is added to their benefit, they come for a day, and if another consultation added to their therapy, it's a 2 day venture, and the patients are not comfortable spending 2 days if the caregiver is a bread earner of the family. Then there are some religious beliefs that okay, this regarding mental health also, cancer also, which comes in between receiving supportive care for the patient. All this can be prevented by overcoming barriers and enhancing accessibility. So these are the cancer coping strategies we usually advise. The first one is join support groups, consider rehabilitation services, join social clubs or group classes. As long as the patient is actively participating in one of the other activities, they feel a kind of normalcy in their life. And also exercise, it helps to combat, there is a specific scenario called cancer induced fatigue. So it is because of the treatment per se, it's also because of the drugs, it is because of the cancer per se. So all this can be alleviated by exercise, which have patient can have a decent enough physical activity, like routine activity, whatever he can practice, that helps to maintain a normal lifestyle. Then balance diet, and eventually all the patients who are newly diagnosed with cancer, at least for the time being, to cope up with the new kind of life they're getting used to, should go for psychotherapy or psychiatric counseling. For next slide. Uh, Okay. To conclude this, the impact of mental health among patients with cancer cannot be exaggerated. The emotional and psychological effects of the cancer diagnosis can be significant and can profoundly impact individuals' overall well-being and quality of life. Hence, it is essential to prioritize mental health care and support using various strategies for individuals with cancer that reduce these negative effects and improve patient outcomes.
Thank you,
వాళ్ళది
sir,
మీలియన్
for
Yeah,
the
thank you.
presentation.
Yeah,
Okay,
that's the
so
end of
as we
presentation.
close, I would like to leave you with one key message here that in cancer care, as I highlighted, that treating the body is essential, but caring for the mind is equally important for the overall holistic improvement of patient. And as psychiatrists and as oncologists, our role is to help patients and families to cope with the fear, the uncertainty, the emotional distress, the diagnosis which they have received. And I have a person leading a life, being a bread earner of the family, especially in a country like India, which is where most of the population is, from lower socioeconomic status. So imagine what the family or the patient goes through when they receive this diagnosis. And as I mentioned, key the barriers with respect to seeking treatment is the socio-cultural barriers, especially in our country, where the cancer is also stigma and the mental health is also stigma. So then they resort to some improper treatments like going for some religious treatments, but neglecting the actual treatment which helps. And nowadays we also see on social media platforms that some so-called healers, they start treating the cancers by some body detox or juice, and ultimately the patient worsens and then they come for the treatment at the later point of time when the things are at a very severe stage. So it is very important, as sir highlighted, that screening, there are few cancers which can be screened. Then early diagnosis and treatment has a very important role in deciding the overall outcome, that how patient manages his further life after he or she receives a diagnosis. So, sir, I just had a one question that how you usually disclose the diagnosis. For example, if a patient comes to you with a lump or something, and then you diagnose the patient with some advanced stage of cancer. So usually, do you prefer disclosing the news outrightly, or you hold on, or like what are your views about it?
See, the thing is, in Indian scenario, majority of the relatives, they try to not to include the patient in the disease diagnosis and treatment. But yeah, few patients, they are knowledgeable, like in the era of ChatGPT, like Gemini, and everybody knows if they have a lump. And even like before 10 years also, if we Google, the first diagnosis was always used to be a cancer. So the patients always suspect. But the knowledge, what they expect from us is up to them. Like we usually it always includes a caregiver and a patient. These two are the most important people whom we are supposed to disclose. And yes, we ask the caregiver whether they are comfortable with including the patients in the treatment per se. And if the patient is also comfortable in receiving bad news, yes, there are like we set a scenario, and we have make sure that adequate privacy is provided to the patient, so that that whatever the diagnosis he is receiving, it is between the three people: caregiver, the care provider, and the patient. And if the patient is having questions, we try to listen as calmly as possible, and we always try to give them as simple words as possible. No mumble jumbo in medical terms. We put in patient's own words so that they have a better grasp of the knowledge. Because the cancer, it is not like a one-day venture. It's not like a fever after treating for 3 days. Yes, the patient is cured. No, it's a long-term journey. Even after getting cured, the patients are supposed to be in a long-term follow-up. We have to explain the treatment plan for the present, treatment plan, the side effects associated the patient who he is supposed to, then also the long term implication, long term complication, and the recurrence chances. If the patient is aware of these kind of things, they are more compliant to the treatment, and also it reduces the stress of the patient. Because uh, as we discussed a couple of minutes ago, like, the anxiety is mainly because of the unanswered questions, not the answered questions. If the patient is aware, if the caregiver is aware, they know that what to expect and what has to be done for the things. So yes, we try to break the news in a as simple words as possible and as understandable as possible, as long as the patient and caregiver are comfortable with the new and the knowledge they are expecting from us.
Right. Okay. So very well explained and summarized. So Dr. Anirban, do you have any final thoughts, or otherwise, we have already crossed 30 minutes, so we can stop here. You want to give any concluding remarks?
I think Dr. Darshan has wonderfully conducted today's session and explained in detail how cancer affects people and how mental health is related to that, and especially what are the ground realities that we face, that the population of India face in accessing healthcare and mental health simultaneously with cancer care. So I think it was a good session. We would like Dr. Darshan to collaborate in future with us also for further enriching sessions.
Yes. Happy to do collaboration. So, and I think by the communication and telemedicine coming more into picture, probably the logistical issues regarding the travel and appointments might reduce in future, hopefully, and patients can get better psychological support than whatever they are getting at present. And even the government putting so many initiations towards mental health. Hopefully, we might have to treat only cancer part, and mental health part will be managed side by side, instead of they are put into two separate entities.
Yes. So ultimately, healing is not just about prolonging the life, but also preserving the meaning of life and adding comfort and improving the emotional well-being. So we thank you
Yeah.
everyone who have joined us for this session.